Hello, QHS friends. This is Dr. Marcos, and I'm from my desk. One of my favorite parts of the day when I'm evaluating some of the QHS lab tools is that I get to see the data as it comes. And we make some analysis to make sure that those tools that we design can have an impact in real clinical practice. So as of lately, we're looking at the Q-Cog. As you know, we mentioned that the Q-Cog is a biopsychosocial tool because you don't have time to go over multiple questions with patients to assess their cognitive or functionality. Q-Cog does that. And these are real world data that I'm looking at right now. Over 100 patients have been screened with Q-Cog. And we have today something very, very important. Over 70% of patients, they have some kind of cognitive impairment. 6.2%, they fall into high risk of dementia. And 70+% of people have some functional limitations. It's very unlikely that you're going to detect this in the limited time you have with the patient encounters. Over half of the patient, they have various health concerns, and at least 30% of the patient, they have increased falls risk. And we're approaching the holidays, and people at high fall risks, they have more accidents during the winter because of some of those reasons. So this is fantastic. This is amazing how UCOG can be part of your clinical decision making, but more important as a screening tool. This is to highlight how important it is to have the right tool for the right conditions and the right populations. As you know, cognitive decline and functional decline with age, it's underdiagnosed in primary care because we don't have the time during the encounters. But Q-Cog is here for that. So in my Dr. M's, you will look at the real world data that we just found. So if you want to know more about Q-Cog and other tools that we have to increase your clinical decision making, to engage your patients, and yes, generate more revenue, contact us at QHS. I'm going to keep looking at my data here because it's amazing what we are doing at QHS. See you next time.